Hello everyone, myself Dr. Neeharika Goyal. I am a consultant dermatologist and I am practicing in Delhi in Ashok Vihar. So basically today we are going to talk about melasma, which is a very common pigmentation disorder that we commonly see in our OPDs. So melasma is a pigmentation disorder in which the sun exposed part of the face specifically have a brownish discoloration. So melasma has more of different forms of pattern. It can be either centrofacial in the center part of the face or just the malar melasma, which means only on the cheeks, or it can include your nose, the forehead and the upper lip area as well. So, what are the factors that cause melasma? Is basically your genetics, the hormones, patients who are on hormone replacement therapy, oral contraceptives, are highly exposed to sun exposure. The different theories that say certain hormonal disorders like thyroid are also responsible for melasma. So, what exactly happens in melasma is it's a pigmentation disorder in which there is an increased synthesis of melanin, which forms in different parts of the photo-exposed areas. The melasma can be divided into three categories, which is first an epidermal melasma, which means the melanin is formed in the upper layers of the skin. Then there is dermal melasma, which means again the melanin is formed in the dermal layer of the skin, which is the second layer of the skin. And there is a mixed variety also in which the pigmentation is present in both the epidermis and the dermis. So the most common cases that we usually see in our OPD are the mixed melasma. So how does the treatment affect the types of melasma? So an epidermal melasma, which is more of a superficial melasma, is very highly and good responsive to topical form of treatment, which includes the topical depigmenting creams. The dermal melasma, which is a little bit deeper melasma in the skin, is not very highly responsive to the topical medications that we give to patients. So in general, that patients that we usually see in OPD are the mixed melasma variety. So part of the melasma responds to the topical medication, but there is a part which usually do not respond, which is the deeper part of the melasma. So what are the treatment options available? The first and the foremost thing that we always say to our patient is the basic is sun protection. That if you are not doing sun protection properly, the melasma is going to rebound back, it is going to come back. There is no 100% cure for melasma, first of all, which means that a maintenance or a maintenance depigmenting cream is required in long run to maintain the results that we achieve with various different forms of treatment. The topical depigmenting agents that are available in the market have combinations with hydroquinone, kojic acid, arbutin, glycolic acid, licorice, and alpha-arbutin, which are good depigmenting agents. Basically, they reduce the melanin synthesis, which is responsible for increased melasma. The other in clinic procedures that can be done in clinic are the chemical peels, lasers, which are further used to improve the deeper form of the melasma, which is dermal melasma. The newer therapies that are available are tranexamic acid, the oral as well as the topical tranexamic acid, which is a good molecule for improvement in dermal melasma. So, in general, melasma is not a single modality, it does not require single modality of treatment, it requires a multi approach for a good result. Thank you.